Good evening and thank you for joining us. We begin with breaking news in Ontario. The province's chief medical officer is investigating a case that may be linked to the new coronavirus. Global News has confirmed the presumptive case is at Sunnybrook Hospital in Toronto. Health officials have yet to confirm the case because they have to wait for samples to be tested at the National Lab in Winnipeg. Our Mike Drolet is following the latest developments with the case in Toronto. Mike, health officials still have to confirm if it's an actual case, but what signs seem to be pointing to this new virus?
Well, Robin, a few things line up. Number one, the man traveled from Wuhan, which is at the epicenter of this crisis. And scientists have already mapped this virus and developed a test to be able to determine who has it. Now they're confident enough with this man that they are trying to retrace his steps and get into contact with anybody he may have come into contact with.
Health officials said it was inevitable that Canada would have a confirmed coronavirus case soon. Well, late Saturday afternoon, it was announced that a man in his 50s had flown out of Wuhan on the 21st, arrived in Toronto on the 22nd, and was in Sunnybrook Hospital with symptoms on the 23rd, where he remains in stable condition.
The patient was detected and immediately put in isolation. Lab tests were conducted, and at the earliest signs of a presumptive positive case, Toronto Public Health launched extensive case and contact management to prevent and control further spread of the infection.
Those who were in closest proximity to him have put themselves in self-isolation as a precaution. It speaks to how quickly the virus is spreading around the world and why China is scrambling to get it under control. A 1,000-bed hospital is being built in 6 days, with another on its way.
加油，武汉！
In an upbeat and flashy show of strength, Chinese news anchors urge those affected to strive on. However, the streets tell a different story. They should be filled as China celebrates the new year, but tourist attractions like the Forbidden City, Great Wall, and Shanghai Disney were closed.
In response to the prevention and control of the disease outbreak.
It's that mixed message that has residents in Asia concerned about what is and what isn't true.
We've seen some ambiguous reports coming out of the mainland.
What is certain is that China has taken some unheard of steps to control the disease, with a lockdown affecting 48 million people and a travel ban covering 15 cities in Hubei province.
We've never seen a travel ban like this before, so it's not clear how effective or ineffective this will be.
So far, the World Health Organization has decided against declaring the outbreak a global emergency. Yet it's clear the virus is spreading, with cases in several Asian countries, as well as Australia, the US, and France, where masks are now in short supply. And while Canada can be added to that list, officials say the world is better prepared this time. Already, scientists believe they've traced the origins of the virus to a seafood market in Wuhan, which also sells live animals. And while the incubation period makes it difficult to screen potential carriers at airports, an accurate test has already been developed to determine if a sick patient has been exposed.
We have the full genetic makeup of the virus that's causing the disease. Public Health Ontario have been able to develop a rapid, accurate diagnostic test.
Mike, we've talked about how inevitable it was that Canada would be hit with this virus. What is the risk to Canadians at this point?
Well, officials maintain that the risk is low, even though that this virus is more contagious yet less deadly than SARS. The man in question wasn't in Toronto long enough, very long at all, before he started showing symptoms. He then was taken to hospital where he was put into isolation, and everybody he came into contact with within his own household have put themselves in self-isolation. But considering what is happening in China, officials are trying to be positive, yet they are certainly not taking anything for granted. Robin?
Mike Drolet in Toronto.